Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about healthy bones because you can't live long and healthy unless you have healthy bones. The challenge is that for years we've considered bones as this inert structure and we just attach some stuff to it and maybe we should take some calcium and that's all there is to it. But the human body is far more complex than that, and the reality is that bone is an organ that plays a role in health just like your heart, liver, brain, and lungs. And that understanding really maybe in the past decade or so has come to light of just how important it is. So this also means that bone density and bone health is not just about taking calcium and exercising. So we're going to talk a little bit about that and things to do to improve bone health and also your bone density testing. We need to cover a little bit of that. We're talking about bone density. But what brings this to mind is there was a study done on diet acid load. And what that has to do is it's not acidic food. So people think of like a lemon as being acidic. But when we talk about acid in your diet, what we're really talking about is the ash. So after that product, let's say we burn an orange and we're left with the ash. What is in the ash? What elements? And for something to be more alkaline, which is what we want, it's going to have higher levels of potassium, calcium, magnesium. As opposed to something that's more acid, you're going to have more things like sodium. So we want a more alkaline diet. That cuts across you've certainly heard that talk about cancer and how cancer cells don't metastasize as well in an alkaline environment. That is all true. But our bones respond much better to an alkaline diet. So there are graphs all over to look for dietary acid load in foods. But to give you an example, sea salt is very alkaline. Table salt is very acid. So just switching from table salt to sea salt will help your bones. Having more fruits and vegetables, less processed food will help your bones. So in this particular study, they looked at a little over 2,000 people. They looked at two different studies, the patients in two different studies. These patients either had high risk of cardiovascular disease, heart disease, or metabolic syndrome, prediabetes. So these people had other health conditions, and they wanted to see what diet played a role, or how much diet played a role in their risk of having a fracture. So in the study group, following them for about almost 5.5 years, a little over 5 years, they identified 114 fractures, and in the people who had fractures, they were 87% more likely to have a fracture if they had a high acid load in their diet. So eating a more processed, junky diet, less fresh fruits and vegetables would have led to more fracture. So we've always known that this is important, but it's always interesting to be reminded that our diet plays a big role in bone health. But we can't have a talk about bone health unless we need to talk about first bone density testing and then some other things we can do to help with our diet. One of the things to understand with bone density testing, and I've certainly talked about this before, is when you get a bone density, you should get two scores. One is the Z-score, the other one is the T-score. And the T-score has everything to do with your risk of osteoporosis. And in general, that T-score is compared to so like for me, it'd be a 40-year-old male that never gets older. So over time, your T-score will get worse because who you're comparing it to, that person never ages. Their bone always stays the same. The Z-score, however, is age, race, gender matched. So recently had a patient who is in her 80s and her T-score was pretty low and her doctor was concerned because she's had some fractures, but these weren't low impact fractures. These were falling down marble stairs fractures where any one of us probably would have broken multiple things. And her Z-score, however, for her age, female age, white race, was actually pretty good. So the question then is like, do we need to treat that if her bone density is exactly where we would expect it to be? So some things to consider. Also, when it comes to bone density, we all know that exercise is important. Vitamin D is important. Um, Having good gut health is important. One of the things we didn't understand even 15 years ago is that when your gut is inflamed, it dings your bones. So people who have food allergies, people who take like SSRIs, like Prozac, that increase serotonin in the gut and mimic an inflammation, will have lower bone density. And that's also why people who take drugs that block acid, so like Nexium or Prilosec, will also have low bone density. It all makes sense when you understand how much the GI tract plays a role. I will also lastly briefly talk about calcium supplements. I'm not a fan. Rarely do I recommend calcium supplementation, and the studies don't support it on top of a good quality diet. So I would rather see people eating lots of green leafies and getting calcium in their diet combined with sunlight exposure and good vitamin D levels, and you'll absorb all the calcium that you need. The only time I would generally recommend calcium is if somebody's T-score is getting really low and we're concerned, in which case I would recommend a bone support formula that contains not just calcium but also strontium, silicon. Forget that. They usually don't contain strontium, but that will contain silicon and magnesium and everything else that goes into bone health. So as always, I will post a link to this particular study in the description. Make sure you give this video a like, share it with somebody who you're worried about their bones, and subscribe to the channel.